Hello, I'm Kenneth Cutbush, an orthopaedic shoulder surgeon working in Brisbane. I'm with Lucy Angelini, a shoulder physiotherapist. Have you got a snapping scapula, a crunchy scapula, and you're wondering what can be done about it? Well, we're going to tell you what you're in for after the surgery. So, snapping scapula or scapulothoracic crepitus is a phenomenon where you get crepitus or audible or palpable vibration, and certainly it can be audible, coming from underneath your shoulder blade as it moves over the rib cage. It's actually a fairly relatively common thing. We see a lot of people with shoulder problems get some crepitus there underneath their scapula. Most of the time it's really mild, and it is a condition that's treated with physiotherapy. Physio. Rehab can be arduous and long, and the way I think about it is your shoulder blade, your scapula has got into bad habits. The muscles that control the position of it have got lazy and are letting it hit the rib cage and rub there and set up a rub. And that rub then becomes something you can hear, well, you can feel. If it's really bad, you can actually hear it. And this is when you lift your arm up overhead. Some people, it's really quite disturbing, isn't it, when you hear it, the snapping scapula.
Yeah, absolutely. It can be quite loud.
And the treatment is one of rehab. It's not one of surgery. But in a very rare circumstances, surgery can be considered. So if you've got intractable snapping scapula or scapulothoracic crepitus, there is an operation that can be done where we resect the upper part of the scapula, the top corner of the scapula, the superomedial pole of it. And I do that arthroscopically. So it's quite a rare operation. It is done in some patients that have severe intractable scapulothoracic crepitus. And the thing to be aware of, I would put the success rates around 50-50. About 50% of patients it does really well in. About 50% of patients, eventually their symptoms return to at least some extent. And that is one of the things about it. And that's why we don't do it very frequently. But in certain patients, it is where we go. So we're talking about, and then one other thing to talk about is there are rare patients that have little bony growths or protuberances, little spurs or so on, underneath their shoulder blade that's actually causing that is actual cause. And in those patients, removing that bony protuberance or bone growth will actually cure the situation. And so that's a slightly different thing, but the rehab is the same. So Lucy, this is a keyhole operation, an arthroscopic operation. The patient's typically in hospital overnight with me. So they'll see the nurses. The nurse will change the dressings. They're going to be getting out about 10 a.m., but they're going to see the physio that morning. Take us through that visit.
They are, yes. So they'll have a sling for comfort. So we'll teach you how to take that off and put it on, and show you the best way to dress yourself and have a shower. But we'll be getting your shoulder moving. So we'll be doing some stretches. Your physio will show you how to move your shoulder in all different directions. And the most important thing that we'll be teaching you about is the scapular positioning. So really making sure that you've got your shoulder blade in a beautiful up and back position so that it's not down and forward on the ribs.
Yep. So you don't need a sling. In fact, we want you to be moving with it, but you will have a sling that you can use if the shoulder's sore and to rest it. Post-op, it's going to be a while before you're up to driving your car. You need to be, of course, able to control the car and safely. And we're going to be seeing you back at 6 weeks after the operation. Yes. So what do we do at that 6-week point?
So at that 6-week appointment, we're looking at your range of motion. We're looking at your scapular mechanics. So oftentimes you've had shoulder pain for a long time, and so there's lots of issues that we're helping you overcome. And we'll be communicating with your local physio, who you've usually been seeing for a while in the lead up.
Yeah.
And so just making sure we're all on the same page in terms of getting your shoulder blade moving appropriately.
Yeah, and the physio is really important because the surgery is to help you get over this thing, but the big issue is the muscular control of the position of the shoulder blade and the scapula, and that's something you need to work with your physiotherapist. So the surgery is only part of the whole thing. It really is, the rehab is the most important part of it. And they're going to be doing lots of rehab. And probably, for 6 months.
Yeah. It's almost likened to, letting your shoulder blade learn how to walk again. You're re-establishing these appropriate patterns of movement, and it can take a while.
Yeah. And we'll typically see you back at 6 weeks, 12 weeks post-op, and then usually at 6 months and see how you're going. And we're here, we'll be supporting you along that. And each time you'll be seeing the physio, and we'll be writing to your physio so that everyone stays on the same page as to what to do with your rehab. But it's a slow sort of thing, isn't it?
yes, normally isn't a quick fix, but yeah.
Yeah, I would think my experience is that the surgery will stop the crepitus to start with. What we're really wanting to avoid is that crepitus, the crunching, starting back up again. And that's why the physio is so important with this operation. So there you have it, the rehab for snapping scapula or scapulothoracic crepitus, and that's what to think about. Thank you for listening.